That's a great question. There are a few different classifications of bladder cancer. The first is kind of what it looks like under a microscope. So although there are several different so-called histologic subtypes, the main one is urothelial cancer, and that composes about 90% of all tumors. The next and probably most clinically impactful is whether or not it's non-muscle invasive or muscle invasive, and that really dictates a few things. First, it's whether or not the tumor grows into the bladder, into the lumen, the middle of the bladder, or through the muscle. And if it grows through the muscle, it's a lot more of a fatal disease, and usually it's treated by so-called neoadjuvant therapy, followed by surgery to remove the bladder, whereas non-muscle invasive disease, although can recur fairly frequently, can just be kind of scooped out in a less invasive manner with the ability to retain your bladder. So neoadjuvant therapy, or therapy given prior to the radical cystectomy or removing the bladder, is mainly for trying to kill off any of the small cells that have broken away from the tumor and could be throughout the body. This way we can reduce the main tumor size, but also kill any cells that may lead to metastases or growths in other organs following the full removal of the bladder. So there's a lot of focus now on being able to retain your bladder. And so one of the main points in knowing whether or not you could either be spared a cystectomy or getting your bladder removed is the success of the neoadjuvant therapy. And so whether or not following this chemotherapy that's given before surgery, your tumor is completely gone or not. And if it's completely gone, there's a lot of research now to suggest that with a lot of really close monitoring or followed up by radiation therapy, that patients are able to safely retain their bladder. So there's a lot of research right now going on to see what factors modify the success of therapy. Different mutations that occur within the tumors can affect the sensitivity. The amount of immune cells that are within the tumor or around the tumor in its so-called microenvironment are thought to be markers of success. And now with a lot of the new therapies coming online, it comes down to a lot of the properties of the tumors and what genes or proteins are being expressed, and can we target those specifically. So as I said, there's a lot of therapies now that are so-called precision medicine, so target the individual nature of each tumor. And so these include antibody drug conjugates, which have been shown to be very successful in kind of the metastatic setting or advanced bladder cancer. And so these target specific markers on the tumor that deliver drugs directly to it. They're also viral therapies for non-muscle invasive cancer, but a lot of these are focused on patient or tumor specific properties and really focusing on only killing bladder cells while producing the least amount of side effects.